What I have seen over and over, both in my practice at MD Anderson and all over the world, is that women are dying unnecessarily of cervical cancer. In my experience, the problem is the same everywhere, whether it's being an uninsured woman in the Rio Grande Valley or being in El Salvador or Africa. It's just really getting access to all the preventive measures that we know work really well for cervical cancer. In the US, whenever I see a patient who has advanced cervix cancer, most of the time they've had screening at some point, usually a Pap test or HPV test that was abnormal, but then they didn't have access or have the resources or the knowledge to come back in and to be navigated to an appointment to get treatment for pre-invasive disease. Because HPV infection or abnormal Pap is usually totally asymptomatic, the cancer slowly grows over years, and then they come in with advanced cancer that requires either radical surgery or radiation therapy, or sometimes, unfortunately, there isn't anything we can do to cure it.
We are located in the southernmost part of Texas, right where Texas, the Gulf of Mexico, and Mexico meet. We are in some of the poorest counties in the United States, and so obviously our population is overwhelmingly low income and has a low health literacy rate. Additionally, more than 90% of our population is Hispanic, and a lot of those folks only speak Spanish. So those are kind of the things that we have to deal with when thinking about providing care to patients. We have to work within those realms to be able to be effective. We have folks who've not been able to get seen by a doctor in many, many years, certainly not have any screening procedures done. And that's why we have a population that has one of the highest cervical cancer rates in the country. It's very important for us to be able to access that population, provide the screening tests that they need, follow-up treatment, so that we can change that. There's a lot of barriers for some of our population to access care. And one of those barriers was transportation and having access to providers within their communities.
When I came down here, one of the things that had happened is that they, through a local philanthropic organization, they had purchased a mobile van, realizing that there were a lot of communities that didn't have access to the brick and mortar clinics that were here. It was being used basically for primary care and like health fairs and taking blood pressures and everything. And when I went to view the van, it was impressive in that it had the ability to do sort of full women's health care. So we started looking into that and realized then, talking to a number of community groups, that were very excited about the possibility of providing cervical cancer screening services and contraceptive options to women in the local communities that really had a challenge getting into clinics. We have been using the van initially as a pilot project to just see if it was feasible to do it, and it was. So we can do most basic women's health care, and really we're focused on family planning and cervical cancer prevention are the two main themes. We have a residency program and medical students, and so in addition to the expanding clinical care to those patients, it's also an educational opportunity for our learners to get out into the community and really get engaged and really provide a service that they find very rewarding.
So we have a very strong collaboration in the Rio Grande Valley where we're doing several different research studies and capacity building programs to improve the cervical cancer rates there.
We do outreach and inreach within healthcare systems that have already been established here to try to increase the cervical cancer screening rates. The inreach consists of us helping our collaborators to reach patients within their systems that have rarely or never screened. And we particularly looked at women that had not had a Pap smear in greater than 3 years. And then we reached out to them via phone and encouraged them and educated them on the importance of screening. And the outreach part is to go out into the communities. We went to health fair events. We went to supermarkets, and we reach women doing their day-to-day activities. And then if we find women that are in need, we help navigate them to services.
Bueno, hace como 2 años, yo desde hace como 10 años estoy yendo a la clínica del condado, aquí en Harlingen, a hacerme desde que estaba embarazada de mi niña, la que tiene 11 años, bueno, entonces ya tiene más tiempo. Y siempre me he hecho mis papanicolauos ahí frecuentemente, ¿verdad? Todos mis chequeos, pero hace 2 años un resultado salió anormal. y me refirieron para acá, a venir a que me checaran más a fondo, ¿verdad? Tenía mucho miedo, yo pensé que ya estaba muy enferma, que algo iba a pasarme. Pues yo esperaba algo como bien doloroso, bien como yo pensaba, bien trágico, pero la verdad no, muy cómodo. El doctor es muy buena gente, me explica muy bien, muy cuidadoso. De hecho, ayer que vine, pues no, ni siquiera sentí ni una molestia y todo muy bien. O sea, él me explica paso a paso lo que va a hacer y cómo, por qué me refirieron para acá. O sea, él me explica todo bien perfecto, está muy bien. Pero es bien importante porque podemos prevenir muchas enfermedades y tal vez si nos damos cuenta a tiempo, se puede hacer algo. En cambio, si no lo hacemos, ya cuando vamos y tenemos algo y está avanzado, a veces ya no se puede remediar las cosas.
You know, the community health workers that we have, they're bilingual. Most of them are females, and so they speak and look like the people that we're trying to serve. We want women to screen because this is the only way we're going to find precancerous lesions, which is where you can eliminate the cells that can turn into cancer. A lot of people live in the shadows. There are people here who are undocumented and are afraid to access health care. I am from here, and so when I speak to you, I feel what I'm telling you because we've lived it.
I'm just really happy to be part of a team here in our community and our institution that really has a strong passion and enthusiasm to care for the underserved. And I hope to be able to continue to grow this collaboration so that we can continue to have a positive impact in our communities.